My name is Liz Smith, and I'm 32 years old, and I was first diagnosed with endometriosis at age 24. However, I started experiencing symptoms at age 11. I've undergone 3 surgeries now, one including the removal of my left ovary and my left fallopian tube. And while I have definitely dealt with physical and emotional challenges, I do not believe that endometriosis defines me. It has actually only made me stronger.
Absolutely. And Liz, we thank you for sharing your story. We're sending you light and love as you conquer this disease. Again, this episode is dedicated to Liz and all the women out there dealing with endometriosis. And we're taking a closer look at this disease with Dr. Jocelyn Slaughter, an OBGYN here in Metro Atlanta. And joining the conversation now is Diana Green. She battled endometriosis for more than a decade. She is here with her husband, Reginald Green, who has been a soldier in the fight the entire time. I love and respect this type of opportunity to showcase both of you, because this has been real for both of you, right?
Yes.
Let's start just talking about what this has been like for you for years.
Debilitating. It's been life-changing.
How so?
The pain, having to move around daily activities, having to call into work. I'm an occupational therapist, and I work in a setting and I do home health, so I can plan my day.
Yeah.
But on the week during the immense pain, I have to rearrange my entire life.
And I want to just apologize for the interruption, but you say the week
The
of
week.
and this is every month?
Every month. Every month is a week for a month. So about day 1 to 3, I'm in fetal position, not eating, not drinking.
goodness.
By day 5, I can probably stand upright.
And this has
walk.
been like this for
10 years.
A decade. Reginald, what is this like for you? Because I understand you kind of track and plan vacations around and are really being very supportive, trying to help your wife manage something that you've watched her suffer with for years.
Oh yeah, it was quite difficult. Once I got the education of what it was and how much pain and discomfort she was in, it was life-changing for myself to figure out how to do things without her while she was laid up in bed.
And going through this. Doc, I want to talk about how something like this can persist for 10 years. And that's the story of many of the women dealing with this, many of your patients as well. While we talk about some of the treatment options.
Yeah, so because most of their symptoms come around their periods, and for a lot of women during this time, they're trying to get pregnant. So a lot of the treatments for endometriosis involve birth control or stopping them from having a period. But many women are trying to get pregnant. So if you're trying to get pregnant, and she was one of my patients for a long time, we were going down that road to try to get pregnant. And so during this time, she was suffering through periods.
Right.
Being on pain
Because you don't want to
medication.
stop the body's ability to do this
Exactly.
naturally. Right.
Exactly. And so that time of that cycle can just be so horrible. And having a patient and a doctor relationship where you understand what they're going through and you're trying everything you can, but also respecting their wishes of fertility is definitely a balance that we have to do as doctors.
Right. And I know Dr. Slaughter is your physician, is your OBGYN. What other kind of treatments have you considered, or did you have to sort of put to the side because you were trying to have a child? And we should point out you have a beautiful, beautiful child, right?
Yes.
16 now.
16,
Right.
yes.
So that worked. But what have you wanted to do versus the route you've had to go?
We've tried changing my diet. I've done paleo. I pulled him into it as well too. Keto was the one that Dr. Slaughter actually suggested we try keto-ish, and keto actually really helped the pain. So I went for a 10
okay.
to maybe a 6 or 7. And that was progress
Wow.
for us.
Yeah.
That was progress for us. And what other treatment have we tried?
Doc, what are the other options?
So absolutely, diet changes can help. Lowering carbohydrates can lower your estrogen level, and sometimes that estrogen is what is feeding endometriosis. So when we talked about diet changes, I knew that would help her. And we also do birth control pills, Depo-Provera, different things, pain medications, and then also we can also try a surgical route. Some people get their ovaries removed, or if there's a mass, or we call it endometrioma, that is caused by endometriosis, we can remove that surgically through laparoscopy. Sometimes
There's a lot.
definitively, we can just remove the uterus.
Just a whole hysterectomy.
A whole hysterectomy sometimes is something that patients go to because that pain is still there. Some patients actually will flip it and will just get their ovaries removed because the ovaries are the source of the estrogen. It's so many treatments, but again, the majority of them either prohibit you from becoming pregnant temporarily or can stop the ability to become pregnant in the future.
And just before we run out of time in this break, you have the hysterectomy, but there's still pain?
There's still pain every month.
And that's because of sort of the cell escape?
The cell escape, and again, if you maintain your ovaries, the ovaries are still there and they're providing the estrogen. So we discussed a lot about you still have your ovaries, you need them because ovaries are needed for heart health. Removing ovaries prematurely can increase women's cardiovascular risk and it can decrease their bone density.
But they're also there becoming a nest for
nest for the endometriosis.
Wow,
so there
many
are
issues.
medical medications that we've done that have been successful in decreasing the amount of estrogen that is out there.
And we're going to talk more about that when we return because there's so many layers to this and so many ways that this disease attacks the uterus, right?
Yes.
So we're going to continue this conversation. Up next, you're going to meet Casey. It took her for a decade for doctors to figure out what was happening to her uterus. It was a frustrating ordeal trying to figure out what was going wrong. You're going to meet Casey and hear her story when she returns.